What do I think are going to be the top facial plastic surgery trends of 2025? Hi, I'm board certified facial plastic surgeon from Houston, Texas, Dr. Delaney, and let's dive into it. Number one is the return to facelift over fillers. Now, don't get me wrong, fillers are a great product and they have their role. But what we've seen is over the past several decades, fillers have been used in place of surgery. And what patients are noticing is that the results that they're getting from the fillers probably aren't as good as what they could get from a facelift or some similar type of surgery. Now, especially with the improvement of our facelift surgeries and the power of the deep plane facelift to restore youthful contours, we're finding, and we're going to find, I predict, more and more patients dissolving their fillers and looking to get facelift surgeries. This is not to say that there's no role for fillers, and certainly it can be still used to add volume, but I think it's best used as a complement to facelift surgery rather than a replacement or a method to prevent or delay facelift surgery. Number two is the resurgence of facial fat transfer as an option to restore volume to the face. Kind of along the lines of number one, more and more patients are beginning to get filler fatigue. They're finding that sometimes when you're trying to use filler for everything, you could get a little bit overfilled, maybe a little bit puffy looking, and it doesn't quite look natural. And so we're going for that natural look. So starting this year, and imagine even more so in 2025, more and more patients are going to elect to have facial fat transfer, where you take your own fat and you inject it into the face to revolumize the face. You also have the added benefit of taking that same fat and creating nanofat and using it for its regenerative properties. Now, the beauty of fat transfer is it's much longer lasting, and you can usually inject a much higher amount than you can with filler while still being economical. So watch out in 2025. I believe more and more patients will be looking for more natural volumization using their own fat. Number three, brow lifts, especially a temporal lift where we lift primarily the tail of the brow, will become more popular as patients undergo more and more toxin fatigue, such as Botox, and they don't like having their brows frozen all the time, or they're not happy with the results that they're getting with their chemical brow lift. So they're looking for something a little bit more powerful, longer lasting, yet still natural in appearance. Therefore, I predict that in 2025, even more so than in 2024, people are going to be looking for natural, subtle, incremental improvements rather than extreme, drastic looks. And whether this is through the combination of surgery, fat transfer, and judicious use of injectables, people are going to look to enhance their individual beauty subtly rather than going for a really drastic